The knowledge is always there that there are disparities in healthcare, but I think walking in someone else's shoes, even as an exercise, is so frustrating, and it still has me a little emotional.
Welcome to the first stop in your journey, social determinants of health. Can I have your card?
Sure.
Okay, so I'm just going to ask you a series of questions about your social determinants of health. So if you just look at your card and give me an answer.
Okay.
Do you earn $90,000 or more a year?
I'm on Social Security, so no.
Please. Thank you.
I was in a nursing home on Medicare. Whatever card you picked determined whether you were getting more tokens or whether they were being taken away. You know, you never really think about how many factors are kind of out of your control.
You were able to participate in a clinical trial for a treatment for your condition. So you get 2 tokens.
We were definitely able to fill our prescription with no problem. You know, we had access to transportation, access to a clean environment, sufficient salary. I definitely felt fortunate going through the steps.
Your city has been put under a water boil advisory. Please give up 1 token.
Stepping into that role, it kind of hits home a little harder. The system should be able to help me with whatever it is I'm facing right now.
Welcome to Stop 5, Transportation. Please pick a card. Your closest pharmacy is closing. You now need to travel an extra 30 minutes to your new pharmacy. Please give up 1 token.
I remember thinking at one stage when I pulled a card that would double my income, it still was not enough to fill my prescription.
Your physician prescribes you a treatment, but your insurance won't cover it unless you fail another treatment first. Give up 2 tokens.
In our society today, it's not only just the income disparities that have an effect on our health, but it's all these other factors as well. And I think that was part of the experience that I really took away.
I think if we could educate policymakers about that too, I think it could make a difference. Some people who are disadvantaged, they have like a lot of things stacked against them.
Even for people who are in the healthcare system, it can be hard to navigate. So a simulation like this really puts you in the shoes of a lot of Americans who are having these challenges day to day.
You lost your job and your insurance, but all the plans on the exchange are too expensive for your new budget. Please give up all of your tokens.
Welcome to the last stop. I'm your pharmacist today, and I really hope you can afford your prescription. Do you have 30 tokens, which represent your out-of-pocket?
No.
Can you give me what you have?
Yes.
Okay.
9, 10, 11.
I'm sorry, you can't afford your prescription today. Do you have 10 tokens?
I believe so.
All right, you need 17 tokens. Do you have 17 tokens?
I don't think so.
I don't think so.
The outcome was not what I expected. Getting to the end and having to have enough money to afford the medication that you really need was a shocker to me.
It is sad, I think, that in this day and age, people of color still experience disparity. It's the way things are, but I'm hopeful that with things like this, programs like this, and more awareness, that it will change, that it can change.